the then administration, through the legislature, passed Cap 255 laws of Kenya that gave birth to the National Hospital Insurance Fund. At the time, the premiums were Kenyan shillings 10 bob, and the benefit package that members were entitled to was only inpatient treatment. And for a very long time, you might have heard Kenyans allude to the fact that NHIF ni ya kitanda. I'll take this opportunity this morning to demystify by giving Kenyans a breakdown on the benefit entitlement, what I refer to as the scope of cover that they're entitled to.
Is there something, I mean, is there a gap here that is not so clear, first of all, between the Kenyans, the hospitals that they go for, you know, to get medication, and NHIF? Because by the time someone confidently says that NHIF ni ya kitanda, it's because basically they've gone to hospital and that's what they've been told, and that's the only service that they've gotten. Personally, I have gone and used NHIF, and literally it actually paid for kitanda, and so it becomes difficult for them to acknowledge that it can go beyond that. And I think our main mission this morning is largely to speak to those ones that perhaps have not joined the bandwagon, and bandwagon in a good sense in this time around, because then we really want very many people to join in because of accessing health. Those ones that are employed, those ones that are not, so that they can remit, you know, even in their very own capacity. So when we speak to them, do you confirm this morning that it is beyond kitanda, and how?
Thank you, Linda. Very important question that normally crops up whenever we have stakeholders engagement. I want to quote the Holy Book, in the book of Hosea 4 verses 6, that my people perish because of lack of sufficient knowledge.
Yes.
Indeed, some unscrupulous healthcare providers have preyed on the ignorance of Kenyans and erroneously indicated that NHIF only caters for the bed. Now, we have 10 benefit packages that are currently administered by NHIF. They include the following, and I'll go to the package content later if you allow.
Yeah.
We have the inpatient treatment, we have the outpatient treatment, we have the maternity benefit package. In NHIF, we say this, Mungu akileta mtoto, analeta na sahani yake.
Okay.
Then we have the renal dialysis. We have kidney transplantation, which is done with the National Teaching and Referral Hospitals and the level 6 facilities. We have the highly patronized oncology benefit package, or the cancer benefit package. We also administer diagnostic imaging, whereby we cater for comprehensively for magnetic resonance imaging, MRI, computed tomography, CT scan, ultrasound, and the latest technology in town for diagnostic imaging for purposes of cancer staging, known as PET CT scan, that is currently available in KU and Aga Khan.
Yeah.
Sorry. The other thing that we do cater for comprehensively is the revamped mental and behavioral health benefit package. Previously, it was known as the drug and substance abuse package, but after the COVID-19 pandemic, and due to the rise of mental illness in this country, that benefit package, in line with the strategic purchasing of healthcare services, that we develop packages in line with the health needs of the society. The package was reviewed. It is now known as the mental. And when I say mental, it caters for, among others, mental illness, schizophrenia, depression, and others. The other benefit package that we do cater for is overseas treatment, or treatment in other jurisdictions. If you are sick and you cannot be treated within the territorial boundaries of Kenya, because the nature of treatment you require is specialized, you can travel to far lands, especially in India, which is a common destination for Kenyans, to seek further treatment, amongst others. Yeah.
Okay, and so my question then would be, who does it cover? Is it applicable to basically everybody, or all these are available to specific individuals? I hope we have a glass of water. Oh, yes, we do. Yes.
Now, before I take the water, as per the NHIF Amendment Act of 2022, that was signed by the President on 10th January 2022 with a commencement date of 28th January, it is now mandatory by law for all Kenyans who've attained the age of 18 years to be members of NHIF. What the law says is that for those in gainful employment, they'll be deducted a part of their salary. As per the current contribution structure, which is being reviewed, members contribute between 150 shillings and it is capped at 1,700. This contribution structure was ratified in 2015 through Parliament when Kenyans wanted additional services to be considered. And in line with the wishes of Kenyans, the same was revised and passed. And after the passage of the contribution structure, the benefit package grew in leaps and bounds to witness, among others, introduction of the surgical benefit package. We had the cancer package, emergency evacuation, and others that were not previously catered for. So I want to tell Kenyans this. The law is very clear. For those in gainful employment, and we are looking at the review of that contribution structure in line with the government's mandate of 100% attainment of UHC, they will be deducted. And the proposal that is there currently, that is before Parliament, and we are having public participation, going ahead in line with the government's mandate of ensuring equity in contribution. Remember, a person contributing 150 shillings could be contributing 3% of his salary. And the one contributing 1,700, earning, let's say, $1 million, could be contributing 0.0001%. And the government, because when we talk of UHC, we are talking of equity. All people are equal in the eyes of the law, as sought to standardize that. And the good news is that for people earning below 35,000 and below, they will get a reprieve in the sense that they'll be contributing less if the law is passed, whereby all Kenyans will pay 2.75%. But I want us to look at the positivities. There will be an addition of 6 packages if the proposed changes are put into law. For the first time, Kenyans can get comprehensive treatment for chronic ailments. Remember, due to the lifestyle diseases that Kenyans are ailing from, we have a large number of Kenyans that ail from diabetes, hypertension, high blood pressure, and others, which are very costly to treat. With the passage of these laws, Kenyans will be cushioned. And I want to make reference to the definition of UHC. It's ensuring that all people have access to an affordable, accessible, quality health care services without exposure to financial hardship or out-of-pocket catastrophic expenditure. So that will be taken care of. Let us look at the big picture. What we stand to gain, the benefits that accrue.
Where are we at in terms of percentage of getting Kenyans, 100% joining into NHIF?
Very important question. UHC is a journey. It did not start when the government expressed its intention and anchored universal health coverage as part of the Big Four agenda. UHC started right from independence when the then government made it mandatory for people in gainful employment to subscribe to NHIF. Now, on the issue on where are we, remember in 2018-19, when the president announced in his second term of office that one of the Big Four agendas will be attainment of universal health coverage. And for that matter, he was on record saying it will be 100%. We had a pilot that was done in 4 counties across the country. The pilot was done in the following counties. One, it was in Kisumu, Isiolo, Machakos, and Marsabit. The counties were chosen based on the following factors: the population size, poverty index, disease burden, amongst others, and the urban areas. Why we did the pilot? We wanted to have a clear grasp of what we want to implement in this country. It was a test run, if I may call it so. what happened in the pilot, the government used what we call input-based financing. When we talk of input-based financing, it is whereby the government was able to procure medications, procure equipment.
Yeah.
For that matter, you might have had the government procured MRI, CT scans, and many other equipment across the country. They were able to employ medical personnel who are deployed in those 4 counties. And citizens were accessing healthcare services, walk in, walk out without paying a single cent. At the end of the pilot in the 4 counties in 2019, one of the lessons that we learned is that the input-based financing was not sustainable. It did not meet the objectives of UHC of ensuring that everybody is carried along. And for that matter, for the UHC scale-up, where the remaining 43 counties were brought on board, the proposed mechanism was output-based financing, whereby the government was to support indigents who could not be able to pay premiums. And for that matter, UHC was transitioned and nested in NHIF as the vehicle through which the government intends to attain 100% attainment of UHC. Now, on the UHC journey, where are we? His Excellency, the former president, launched UHC in Mombasa County on 5th February 2022 at Port Reitz Hospital in Mombasa. And part of the agreement that the national government had with the county government was to sponsor indigent households. Remember, NHIF is a family-based cover, and it caters for the principal member, the declared spouse, and the children arising out of that marriage or adopted children. So the agreement that the national government had with the county governments was that they were to support or sponsor indigent families to the NHIF scheme. Now, what happened, there was a baseline survey that was done by the Kenya National Bureau of Statistics in 2019 that was titled Housing and Population Census. In that particular baseline, it was noted that Kenya has 12.1 million households. Out of the 12.1 million households, 5.1 million households were indigent. When I say indigent, these are poor and vulnerable. In the first phase of the UHC scale-up, 20% of 5.1, which is approximately 1 million, were onboarded to the national UHC scheme. They were identified by State Department Social Protection and the county governments. And I want to tell Kenyans, from 1st of January 2022, NHIF has been offering the super cover benefit package to those indigents. Apart from those indigents, allow me to expose a bit. We have,
make it brief,
we have the health insurance subsidy program. Under HISP, that is health insurance subsidy program, we do have the orphans and vulnerable children that are sponsored for by the national government. We are looking at 258,000 households that are catered for. We also have the older persons and persons with severe disabilities, whereby we are talking of in excess of 48,000 indigents that are sponsored by the government. In line with the government mandate of ensuring all Kenyans are on board, and our mantra in NHIF is leaving no one behind. The government in 2020 decided to roll out the National Public Secondary School health insurance cover that is popularly known as Edu Afya, whereby all public secondary school going children are catered for, are provided for as members of NHIF.
Okay. All right, fair enough, and a lot of benefits there, and I think there's need to read and consult and find out some more on what then is covered. People are watching and they're asking, well, Linda, I acknowledge what it is that NHIF is doing, and my friend has largely benefited out of it. I am not working, but I'd love to know how best I can register for NHIF, and beyond registration, I think it's more or less like how just does self-care application work. That will come to on a different perspective of it. But basically, first of all, on the aspect of registration, and especially for those ones that maybe are not employed, because mostly when you get into employment, you're always advised on the angles to take.
Thank you, Linda. And I want to salute that member for making the wise choice to register as a member of NHIF. NHIF has made registration so easy. There are various platforms that you can be able to enroll as a member of NHIF. You can visit the 156 service points and complete a registration form, submit a copy of your national ID. In case you are married, you will be required to submit a copy for your spouse and a marriage certificate, because now it's a legal requirement that all marriages must be registered in Kenya, and also supply a copy of birth certificate for children above the age of 6 months. For children below the age of 6 months, a birth notification. The second way you can be able to register is that NHIF has undergone digital transformation. We are currently available on the online platform. From the comfort of your phone, you can dial the NHIF short code, which is *155 hash, and you can be able to select the language of choice, that is English or Swahili. It will prompt you to input your national ID number, and it will be able to register you automatically through that particular platform. The third way, you can visit the NHIF website, which is www.nhif.or.ke. You can be able to go to the online registration, and you'll be required to submit a number of documents to support your application, including your national ID, your spouse ID, and a marriage certificate. You'll be able to receive a message in your email about your registration number. Payment,
yes, because they asked about payment.
They go hand in hand.
Yes.
Even when it comes to payment, there are various modes of making payments into NHIF. You can walk to some of the banks that have signed memorandum of understanding with NHIF. Basically, you can go to National Bank, Kenya Commercial Bank. You can also go to Equity, Cooperative Bank, and be able to complete the NHIF deposit form, whereby you can go to the counter, deposit directly, and the money will reflect in your account real time. The second mode is the online platform, whereby we have a memorandum of understanding, a contract with Safaricom. You can go to your Safaricom M-Pesa, go to Pay, Lipa na M-Pesa, enter the NHIF business number, which is 200-222, enter the account number, in this case, which is the national ID number, enter the monthly premium for self-employed currently. It is 500, but the government is also looking at revising the same. Enter your PIN and send the money. The amount will reflect real time in your account.
All right.
Yeah.
And so it's very important that you meet monthly?
Yes. The Act establishes the time and manner to prescribe.
Yes.
Payments to NHIF should be submitted on or before the 9th of the preceding month. Failure to which it will attract a penalty.
A penalty.
For penalty for self-employed persons, currently, as the law established, it's 10% of the premiums or 50 shillings. But for the employers in the formal sector, it is equivalent to the prevailing market interest rates.
Yes.
Yeah, the CBK quoted rates.
Okay, self-care application?
Very important. We rolled out the self-care application in 2020 to cushion our members when COVID-19 broke out in this country. The purpose of the self-care platforms, it is a one-stop shop where you can be able to check, for example, your contribution history. You can also be able to check the members that are declared in the NHIF database, for that matter, family members. You can be able to check the benefit packages you're entitled to. You can also be able to check the status of pending pre-authorization requests that have been launched with NHIF. You can also be able to engage our members through the chatbot on real time. So it's very important for members listening to me this morning to go to the Play Store or Apple Store, for that matter, for those who own iPhones, download my NHIF app that will empower them. Instead of visiting NHIF offices to make follow-up on questions they want answered, the same can be found at the comfort of your cell phone. And I want to urge Kenyans that we are transitioning to complete digital transformation.
Yeah.
Remember the clarion call by the government during last year's Madaraka Day, which the government, the theme was inspire, create and innovate.
Yeah.
And the government is very big on digital transformation. At NHIF, we are moving all our procedures to the digital platform.
And I'm glad you answered the next question, which was how do I contact NHIF in the event I have any queries? I think the answers then should be in the very same application. Gilbert Mugambi, time flies. It's exactly 8:30 a.m. and we have to close it unless you have 30 seconds of your final thoughts.
I want to use this opportunity to assure Kenyans that despite the challenges, NHIF is slowly working towards 100% attainment of UHC. I want to tell them that the funds are safe and we've put into place mechanisms to mitigate against fraud, wastage and abuse. I want to appeal to Kenyans to be our equal partners as we journey together. My parting shot is true wealth is health, as said by Mahatma Gandhi.
That is 101%. You need to take care of yourself. It's incumbent upon you that before you look at the government side, you have taken that important step. And as it is, we are looking to get 100% involvement. That is in the NHIF as a country. Certainly that would guarantee us